Recent studies have shown that people who know they have health-endangering attitudes, such as smoking and drinking, sometimes put off appointments with medical practitioners because they do not want to unveil their health issues. Others, on the other hand, do not go because they feel doomed despite medical treatment. And others do not go because they feel embarrassed to discuss their privacy and the challenges. The bottom line is fear. For many people, it's fear of bad news and fear of an unfavorable test result. Today, I shall be discussing the importance of routine medical checkup rather than patronizing a chemist. Stay tuned.
Well, what makes me not going to hospital in time to go and do a medical checkup? Because at times, how we find ourselves in this country, there is no money to go and do the medical checkup. At least you have to go to medical checkup in 3 months. But at times you find yourself even a money that you will even do a breakfast, you don't have it. Talk less of to go and check your health. That's what makes me I'm not going to hospital.
For you to go for medical checkup, for you to know the condition of your health, it is very important for you so that you will be able to meet up with the medication to meet up your medical condition. If you did not go for medical checkup, you can't even know. Sometimes you have just a slight headache, and it may not be just malaria, it may be other thing. But if you go for medical checkup, you know the cause of your headache and you're able to treat it immediately.
Go for checkups because they say health is wealth, right? So if I don't know what's wrong with me, I might easily die on time. So it's best I go to prevent or to actually take care of what's wrong with me. So I advise everybody to go for checkup constantly.
Yeah, I do go for checkups because I love my health. Health is all is wealth, just like my brother here says. So if you really want to know about yourself, you need to go have a checkup and all. So I do go for checkups to answer you.
Why I don't go hospital? Because I'm healthy, nothing happen with me. But some people, they go hospital because they're sick. Kuma, the problem, even they not go hospital because of money. Money is the quantity why you no get money to go hospital. But they want to go the hospital. But the problem is money. Money now is very scarce in Nigeria. But if you are people who feel help with medicine free for hospital, even me, I feel go there. Yes. Thank you.
Actually, I don't used to go for medical checkup. And the reason being that I feel that I'm okay. And it's only when I'm feeling a bit of dizziness or my body is weak, then I will think of going for medical checkup. That is when I experience a sign of fever or malaria or typhoid. So I do go for checkup in order to know my status. But normally, I don't used to go for medical checkup. And actually, the reason again being that I'm not financially buoyant. Actually, I know that checkup is good for me to know my status regularly. But for the fact that I'm not financially buoyant, the resources are not there. So I wouldn't just be visiting the hospital for medical checkup. That is just the reason. And at this point, I'm financially buoyant. Even if I'm okay, I can go for medical checkup in order to know my status. Yes.
Mr. Michael Ikenga. I'm a medical laboratory scientist, a fellow of the council, the Medical Laboratory Council of Nigeria, and I work with Capital Diagnostic Laboratory and Gwanson de Kaduna. Like you asked, the first thing to do for any patient that needs medical attention is to report to the hospital. Now there are two categories of patients. One, patients that are coming in for routine checks and patients that are already down. Now, for patients that are coming in for routine checks, well, such patients can hit the laboratory straight on without going through the hospital, because all they are doing is they are not down, they are not complaining of anything, they just want to upgrade their medical status. But traditionally, a patient that is down, which again comes under two categories, ones that are critically down and ones that are just, minimally ill. For patients that are critically down, let me start from there. They can report for medical attention even at 2 a.m. in the morning. Those patients go straight to the emergency unit where there are doctors and nurses and all kinds of laboratory staff to take care of them. Now, the usual one we know that normally occur will be those that are just ill. Those ones should report first to the OPD, the outpatient department, where they are expected to first of all see the doctor. The doctor now will refer them to the laboratory, because even if you are presenting symptoms of fever, what type of fever do you have? You don't know. It could be malaria fever, it could be fever as a result of typhoid, as a result of pneumonia. There are many other things that can cause pyrexia. So the doctor may not know, of course, what caused the fever in the first place. So the first thing for the doctor to do is to refer the patient to the laboratory. Yeah. So in the laboratory we have very, very new procedures that are very fast. It's not like before, except for cultures. Most laboratory procedures will come up with their results on the same day. In fact, in many cases, within minutes. So once the results are out, the patients will now go back to the doctor based on the result of the laboratory findings. The doctor will know exactly how to handle the patient, But if a patient is handicapped financially, the patient may decide, because we know the major problems we have. Number one on our list is malaria. So most patients will present fever that are as a result of malaria infection, in which case the patient may, if the finances are not there, that is not the right thing to do. The right thing to do will be first of all report to the doctor, get paper, go to the laboratory and come back with your report that tells that you have malaria. But why I'm singling out malaria is that in the case of malaria, you may be having fever as a result of malaria even when the result of the laboratory test you have just run is telling the doctor no malaria. Because malaria infection does not occur only in the peripheral blood, which we use for the tests. So if a malaria result is positive, it confirms you have malaria. If a malaria result is negative, it does not confirm that you don't have malaria. One can be having malaria even when the result is negative. For that reason, any patient that is medically grounded to some extent, we commence treatment for malaria even at home before even reporting to the doctor. Because even if you do report to the doctor and the malaria test result is saying negative, it doesn't prevent the doctor from putting you on treatment for malaria. That is before you go to the medicine. That is just the normal procedure. Then your result from the laboratory might even warrant X-rays, scanning procedures, and all that, to fully authenticate where the problem or problems are.
Okay. So, what are the importance of
routine medical checkup? Is like any other problem in life. It's teaching time. We save 9. If you report to the laboratory or to the hospital rather early, and you commence treatment early, the prognosis, that is the rate and the rate of recovery, how we expect you to recover, is different from when you report late. When it is late, in many cases, when it is late, it is late. Let me give you a good example. If you have problems with your kidney function, if you report to the laboratory early, They might just do urinalysis, there is protein in the urine and all that. We suspect that there is nephrotic syndrome, send you for UNE creatinine, that is a kidney function test, and you come up with some minimal abnormalities. You know, you could rectify that with water therapy, with little or no drugs. Water therapy can clear you of that. But if you report late kidney failure, man, difficult to handle. In most cases, in fact, not successful. And this will happen, from our experience, it happens more with women. You know, women, I don't know how their frame of mind is. I'm not a woman after all, so I wouldn't understand that. But most women, if you tell them, okay, the symptoms you have just presented will suggest that you should do tests for diabetes, fasting blood sugar. They will tell you, it's not my portion. Whose portion is it? The other day, a woman came here, ran tests for HIV. She tested positive. I told her, you are positive for HIV. You see, better go to, I told her all the treatment centers. Either go here, there, or there. There are about 5 or 6 registered, recognized treatment centers in Kaduna Metropolis, and all of them are free. Go to any of these centers and obtain professional guidance, counseling, and treatment, or therapy. She said that no. It's not her portion, that she cannot be HIV positive. Good. That she was going to go to a church for treatment, for prayers. She went to a church, did all the prayers, came back. We repeated the test. Lo and behold, the thing was still positive. I thought that she was still positive. She almost knelt down that I should please write a negative result for her. So, are you mad? How can you think about a negative? My prayer is for you to be negative if it is possible. You call it miracle, good. I will pray for you. I will support you in prayers for you to get your miraculous healing. Good. But so far, so bad. You have not gotten one. Your result is still positive. She wanted to need an eye. Went mad. She had to run away, leaving her result behind. You see? So, if you go to the hospital early, good. Most times, you come out with little or no cost, fine and whole. But if you are reporting to the hospital late, what you get is what you deserve. Because most times, if it is late, it is late. Even ordinary malaria. Before the drug the malaria can just take one up. So earlier done is better. That time, twice in a year, go for routine checkups. It makes life easier for you. Thank you.
Regular health exams and tests can help find problems before they start. They can also find problems early when your chances for treatment and cure are better. By getting the right health services, screenings, and treatment, you are taking steps that help your chances for living a longer, healthier life. Your age, health, family history, and lifestyle choices, that is, what you eat, how active you are, whether you smoke, and other important factors impact what and how often you need health care. They say a stitch in time saves 9. Make it a point of duty to go for medical checkup at least twice in a year. It is easy to save up a little money that will cover for consultation cost fee, thereby ensuring that nothing takes you by surprise in the future. Make sure you don't miss out on our interesting specials and our latest news on Instagram and Facebook at Health District Africana, and on our YouTube page at www.healthafrique.com. I remain Peace JATAU, Health District Africana.